anxiety. Approximately 40 million American adults ages 18 and older, about 18.1% of the people in this age group in a given year suffers with some form of anxiety. Anxiety disorders frequently co-occur with depressive disorders and substance abuse. Most people with one anxiety disorder also have other anxiety disorders. Nearly 3/4 of those with an anxiety disorder will have their first episode by 21 and a half years old. There's different kinds of anxiety disorders. By the way, these are all according to the National Institute of Mental Health as of 2010, the most recent data I could get. Panic disorder affects approximately 6 million Americans age 18 and older. About 2.7% of the people in this age group in a given year have panic disorder. Typically develops in early adulthood. Median age of onset, 24 years old. And it extends throughout adulthood. About 1 in 3 people with panic disorder develops agoraphobia, a condition in which the individual becomes afraid of being in any place or a situation where escape might be difficult or help unavailable in the event of a panic attack. Obsessive-compulsive disorders, otherwise known as OCD, affect 2.2 million American adults age 18 and older. About 1% of the people in this age group in a given year have OCD. It often begins during childhood or adolescence. Median age of onset, age 19. Post-traumatic stress disorder, PTSD, affects 7.7 million American adults age 18 and older. About 3.5% of the people in this age group in a given year have PTSD. It can develop at any age, including childhood, but the median age of onset is 23 years old. About 19% of the Vietnam veterans experienced PTSD at some point after the war. The disorder also frequently occurs after violent personal assault, such as rape, mugging, or domestic violence, terrorism, natural or human-caused disasters, and accidents. Generalized anxiety disorder affects approximately 6.8 million American adults, about 3.1% of the people 18 and over in a given year. It can begin across the life cycle, though the median age is 31 years old when it starts. Social phobia affects approximately 15 million American adults age 18 and over, or about 6.8% of the people in this age group in a given year. It begins in childhood or adolescence, typically around the age of 13. Agoraphobia involves intense fear or anxiety of any place or situation where escape might be difficult, leading to the avoidance of situations such as being alone outside of the home, traveling in a car or a bus, an airplane, or being in a crowded area. Approximately 1.8 American adults age 18 and over, or 0.8% of the people in this age group, have agoraphobia without a history of panic attack disorder. The median age of onset of agoraphobia is 20 years old. Specific phobia involves marked or persistent fear or avoidance of specific object or situation. 19.2 million American adults 18 and over, or about 8.7% of the people in this age group, have some type of specific phobia. They typically begin in childhood. The median age of onset is 7 years old. This is actually really important with the 7 years old because from a hypnotist's point of view, it is around 7 or 8 years old when a person starts becoming conscious. And what we mean by that is that they're able to reason, rationalize, and judge the different things around their life. Before then, they're really unconscious, which means that the things that affect them are imprinted into their subconscious mind in a much deeper way than if something affects them later on in life. Now, what you need to understand is that anxiety is worrying about something in the future that has yet to happen. And in generalized anxiety, someone's really unsure of what's going to trigger it. Specific anxiety, such as social anxiety and the various obsessive-compulsive behaviors, it's more apparent in terms of what creates the problems. I would also include fears of various things, since people feel anxiety as a result of feeling fear, such as flying or elevators or escalators, or with younger kids, bees and wasps that might be flying by, close by, or public speaking, fear of insects, fear of heights. And one needs to really kind of think of the fact, if you have these fears, how is this closing down your life? And in fact, most people who suffer with these sorts of anxieties, it does get in the way of themselves enjoying a full and enriching life. And I would suggest that hypnosis is a really good way to go to help relieve yourself of these anxieties, because you're really in a heightened state when you're having these sorts of situations arise in your life, when the anxiety is happening. So you can use that same ability to help you let go of the anxieties. We can get to the cause of the anxieties. We can go back in time to when they first began, and we can easily help you to relieve yourself of them. So think about using hypnosis, because I can tell you, quite honestly, I was having a conversation with one of my clients. She happened to be a psychiatric nurse who was there for, I think it was a weight loss issue at the time. And I was talking to her about the anti-anxiety medications and how they generally don't work. And she just laughed out loud as if it was a joke. Medications, again, they might work as well as a placebo effect, less than 30% of the time. So why not go to the cause of the problem? Release yourself from it once and for all. And hypnosis is a really easy, fairly painless way of doing it. No drugs necessary, which means that your body need not be interfered with in any way, shape, or form from the chemicals it really doesn't need anyway.